year by year, we generally start our intern year spending the vast majority of the year at the university hospital. And the focus of intern year is really becoming proficient in preoperative and postoperative patient management, management of patients on the floor, and then really becoming proficient in the intensive care management of our patients, both procedurally and clinically, so that by the end of your intern year, you're independent in all of those bedside procedures, and you're able to kind of independently manage the patient from an ICU and floor perspective. Then transitioning into the second year, again, we spend most of that time at the university hospital. Obviously, there's a portion of that kind of taking call and really being comfortable triaging consults and being able to really independently manage all facets of neurosurgical care. But in addition to that, that's when you're really gaining all of your initial operative skills, both, of course, opening, closing, but positioning and surgical decision making. You spend dedicated time with kind of each subspecialty and a continuity kind of mindset in order to really feel comfortable that as you move on from your second year, you really gathered all the basic skills in the operating room that allow you to then progress on to our next steps, where you're really working towards being able to kind of manage a whole operative case. So the third year then looks like we usually split time between VA and Children's Hospital. And at the VA in particular, we have a small group of attendings who are really focused in your ability to fully manage kind of bread and butter neurosurgical cases like ACDFs, lumbar laminectomies, evacuation of subdurals, for example. And those attendings really work closely with you step by step so that among your 3 to 6 months there, you're able to really become independent in a case kind of skin to skin. We're really learning step by step how to perfect the use of each instrument and really progress independently. Children's Hospital, you're obviously kind of learning a whole new set of pathology, but you're also gaining a level of independence in non-operative care as well, as you're really can be on call and gaining more independence, more confidence in kind of your non-operative surgical management, while you're also working with a whole different group of attendings and fellows that also kind of progress your surgical autonomy, progress your surgical abilities month by month. Then you take all of that together and move to the fourth year, and fourth year you spend at least half the year at Denver Health, and that's our trauma-heavy rotation. So you're really independent at all sorts of trauma cases by the end of your time there. And I really, from my experience, I felt as though I gained all these separate skills in the first 3 years, and then kind of month by month at Denver Health, able to put those skills together to be able to kind of do cases start to finish even independently, of course with the help and with the support of our attending group there. And then moving on to the fifth year. Fifth year is traditionally our research year. That is really going to be focused on whatever your interests are, and with a lot of flexibility, a lot of support to pursue whatever is going to be kind of appropriate for your career goals. You come back as a 6th year, and 6 years now our chief year back at the university, and all the experiences that you've had prior at all the different sites really come together in your surgical skills, but also just your clinical decision making, your ability to kind of run the service and manage all the patients independently with support as needed. But the goal is that you feel comfortable moving towards that more senior role, that you're able to kind of have all that decision making ability and use support when needed, but feel comfortable taking on more and more of those decisions on your own. And then now we have a 7th year that's more flexible. You're able to do either a 2nd year of research, pursue global interests, or do enfolded fellowships, which residents commonly pursue. I'm, for example, going to be doing 6 months of a pediatric spine deformity fellowship at another site, and the new structure of the program really allows for that flexibility to be able to pursue your kind of subspecialty interests or just become even more proficient in the operating room. So altogether, the program allows you to get progressively comfortable managing patients both inside and outside of the operating room on your own, as well as really pursue and kind of focus on your subspecialty or career interests in a way that's kind of flexible to each resident.